Do you remember The $6 Million Man? An American science fiction and action television series running in the 1970s about a former astronaut, US Air Force Colonel Steve Austin, portrayed by Lee Majors. Colonel Steve Austin is severely injured in the crash of an experimental lifting body aircraft and rebuilt in an operation that costs $6 million, equivalent to nearly $42 million in today's money. His right arm, both legs, and left eye are replaced with bionic implants that enhance his strength, speed, and vision far above human norms. Although this was science fiction back then, today's technology advancements in robotics coupled with AI are closing the gap between science fiction and fact. People born without lower arms and legs are no strangers to the world of prosthetics. From wooden and tin creations of the past, modern replacements now feature silicone, carbon fiber, and cutting-edge bionic enhancements. Atom Limbs, a California-based company, takes innovation to new heights by integrating artificial intelligence into their next-generation bionic arm. This remarkable technology interprets brain signals, enabling a full range of human motion in the elbow, wrist, and fingers. Lighter and non-invasive, it promises a transformative future for amputees. Atom Limbs employs advanced sensors and machine learning to interpret electrical brain signals, enabling precise movement and manipulation of their prosthetic limb. This remarkable arm boasts a full range of human motion in the elbow, wrist, and individual fingers, providing haptic feedback on grip strength to the wearer. The arm attaches via a sportswear-style vest, evenly distributing its weight. While it still has some heft, it's significantly lighter than other bionic arms in development. Remarkably, it's non-invasive, no surgery or implants required. The arm connects to the wearer's residual limb using sensor bands and an interface cup. Atom Limbs reckons it is increasingly easier to operating a digital version of the arm via their control software. With residual muscles in an amputee's arm, it becomes possible to assign the corresponding hand, wrist, and elbow movements, an utterly unique and mind-bending experience. Describing the process of mastering control over a body part an amputee doesn't physically possess is nearly impossible. While this groundbreaking technology is undoubtedly exciting, one persistent concern for individuals with disabilities arises when new products emerge: cost. The landscape of assistive devices is filled with impressive innovations, but unfortunately, many of these come with price tags far exceeding an average yearly salary. As a result, most of these devices remain financially out of reach for disabled individuals, who, according to statistics, are often among the most economically disadvantaged in society. Atom Limbs aims to position its bionic arm around the $20,000 mark, a substantial cost, yet significantly lower than many other bionic products available. Ian Adam, a prosthetics and orthotics lecturer at the University of Derby in the United Kingdom, acknowledges that while this might seem steep, it's actually a competitive price within the industry. However, affordability remains subjective. Adam points out that for some patients, this investment could last a lifetime, especially if they've received an accident payout. Still, not everyone will find it necessary to embrace upper limb prosthetics fully. While bionic arms represent remarkable technological advancements, we must also grapple with ethical dilemmas. These include questions about accessibility, affordability, and the impact on individuals' lives. Practically, the focus on innovation versus real-world application is a critical issue. Britt H. Young, herself a bionic arm user, aptly pointed out that the arms race in prosthetics should strike a balance between pushing boundaries and ensuring practical benefits for users. Tilly Lockie, a social media star who has used bionic arms since childhood, embodies hope for the future. She recognizes the immense potential of these devices. However, Tilly emphasizes that the true measure of success lies in rigorous testing. It's not just about creating impressive prototypes, it's about how these arms truly enhance daily life for users. Tilly's insight is invaluable. She has witnessed firsthand the evolution of bionic arms throughout their development phases. The key lies in user feedback. Those who wear these arms daily provide essential insights. Their experiences shape the iterative design process, leading to meaningful improvements. The Atom Limbs arm, although promising, is still in its early stages of development. The company is diligently collecting data, preparing for regulatory filings in the US. This meticulous approach ensures safety, efficacy, and eventual integration into everyday life. In summary, the journey toward better bionic arms involves not only groundbreaking technology, but also empathy, collaboration, and a user-centered approach. Thank you for watching. Please leave a comment, and until next time, cheerio!